Okay, I'd like to talk a little bit about how to choose a surgeon. I think it's important. Maybe I'm biased because I'm certified by the American Board of Plastic Surgery, but I think, and if you talk to my colleagues, they'll agree, that it's important to find a surgeon, a plastic surgeon who's certified by the American Board of Plastic Surgery. And basically that means they've gone through at least 5 years of surgery training, at least two of which are in plastic surgery specifically. We go through a vigorous testing, both oral and written testing, to be board certified. And we have to have experience in both head and neck, breast, body, as well as all types of reconstruction to be eligible to be board certified. You also want to find a doctor who is experienced with this procedure. You want someone, who, in my opinion, who's very comfortable with doing gynecomastia surgery, and then you have to be comfortable with that surgeon as well. I think there is something to bedside manner, and it's important that you kind of click with your surgeon, that you're comfortable with him or her, and feel good about going into their operating room and letting them kind of take over. So it's probably important to see 2 or 3 people and then make your decision based on all the different criteria. Before and after photos are good to look at, and we have a photo album that I know Lisa and I go over with patients who want to see. And you may want to ask your plastic surgeon about patient testimonials. Do you have anything written from a patient? Is there maybe a patient you could talk to? I know we've been asked that quite often, and although we never give patients' names out without their permission, what we'll typically do is call them, and Lisa usually has a number of patients on a list, and she'll call them and say, we've got a patient, for example, who's really nervous about undergoing gynecomastia surgery. Would you mind telling him about your experience? And that's worked out really well. So back to our checklist now. Are you certified by the American Board of Plastic Surgery? That's my bias. I think that he or she should be. Were you trained specifically in the field of plastic surgery? Now, I put that up there because there are a number of people, and I hate to get into this, but a lot of people in medical marketing will say that they're board certified, but they won't say in what. So I think it's important to ask them, did you train in plastic surgery, or did you train in ophthalmology, like a local guy here in town who calls himself a plastic surgeon? So you want to do your homework. You want to find out what kind of training program your surgeon participated in, and did he finish it, and did he get board certified? Another important question is to ask if someone has hospital privileges to do the same surgery, for a couple of reasons. One, that gives you an indication that that surgeon is respected in the community and has hospital privileges and can do that surgery and is respected by peers and has the ability to do that. And the second thing is you want to make sure that if for any reason there's an untoward problem, something unexpected, that you could be transferred to the hospital if you're being treated in an outpatient facility, and your surgeon can follow you there and take care of you in that hospital. So that's important to know too. And if you're actually having your surgery in a facility, an outpatient facility, is it accredited? As I said earlier, the Quad ASF is very stringent and very rigid, and we have to go through annual inspections to keep our accreditation and go through quarterly emergency drills. So it takes a lot to get to that point to have an accredited OR, and it takes a lot of work to keep it accredited. So that's all important. A couple of other views of our OR here, the operating room on the left and then the recovery area. We try to make it as comfortable for patients as we can. They have bedside televisions. As Matthew mentioned earlier, we utilize the Bear Hugger patient warming system. Studies have shown that you can decrease patient discomfort and, more importantly, decrease the infection rate if you keep the patient warm during the surgery and after the surgery. So we actually start the Bear Hugger warming system in pre-op and carry that through surgery and throughout the time that they're in the recovery room. So their temperature stays normal throughout and they have a better outcome. Okay, back to the checklist. Am I a good candidate for surgery? And it's good to know what's expected of you. Each patient needs to play a role in his care to make sure that he gets an optimal outcome. You want to ask the surgeon what technique he will use. As I said before, I think it's really important in almost every case to perform tissue excision. Liposuction alone, I think, is really only effective in possibly in men who have pseudo-gynecomastia, if you believe that that's an actual situation, where maybe older men don't have true breast tissue, but they just have a lot of excess fat from middle age and weight gain. But in my opinion and in my practice, the best results come from a combination of liposuction and direct tissue excision. You're going to want to ask about risk and complications. As I said earlier, that's a big part of the pre-op visit, where your surgeon should sit down with you and talk about any possible thing that could happen in the surgery. It's fortunately low risk, but risk and complications can occur. It's important to ask about complications and how they're handled specifically. One thing I do that I'm very proud of in our practice is we enroll every patient, whether it's gynecomastia or any other surgery, in an insurance policy specifically for them for that procedure, and they're covered for most common complications for the first 30 days. For example, if you had gynecomastia surgery, maybe you developed some bleeding, you had to go back to surgery, that insurance policy would cover the cost of going back. Let's say we had to meet in the emergency room and go to the local hospital operating room. That should cover that. So I think that's important. There's nothing worse than laying down some money for a big operation and you think you've covered everything, and then all of a sudden there's a problem, you have to go back, and then it's something unexpected and you have to open your wallet. So that insurance policy, when it comes into play, can be quite helpful. And then what are my options if I'm dissatisfied? And I think that's individualized with the surgeon and his practice, and you need to ask them, if I'm not happy, if I have to have more surgery, where do we go from there? And that's something that every plastic surgery practice should have a policy regarding. Okay, I'd like to get into some patient cases. I just want to show you a few people, and then I've got a video clip of a patient who underwent his surgery the day that I operated on the firefighter. This is starting out just a typical middle-aged gentleman who has some excess body weight. He's got some excess breast tissue. He's not really happy taking his shirt off, doesn't want to go swimming in public. And then post-op looks much better. Still a big gentleman. Obviously, he's got good muscle definition and all that, but his chest looks much more natural, and he's much more comfortable going out in social situations without a shirt on. This is a gentleman that I showed at the beginning of the talk. He's in his early 40s. He has left-sided only unilateral gynecomastia. Wanted nothing done on the right side and really didn't need anything. Now, some men have a worse case on one side than the other. This gentleman really had nothing wrong with the right side, and so I only operated on the left. And once again, you can see he's got this on his left side an inframammary crease or a fold underneath his breast that looks unnatural. And then you see that's resolved after the surgery. This is I put this patient in here to show you that a number of men come in with fairly minor problems. This gentleman obviously spends a good bit of time in the gym, works out quite avidly, yet he just has what we call a puffy nipple problem, where he just has basically an enlargement of breast tissue right behind the nipple areola. And you can see that, and I apologize for shadowing. There's some shadowing in the oblique pictures at the bottom of the screen, but you can see that he's got sort of a projection of the nipple areola on that oblique view on the left side, and then it's flat afterwards on the right, in the right view. So someone like that just needs very limited surgery, and Lisa's going to get into cost in a few minutes, but obviously we don't charge the full fee for a full gynecomastia procedure for someone who just needs direct tissue excision with no liposuction and mainly, like in a case like his, limited anesthesia. This is a typical case that I see, a young man who's in good physical shape, spends a good bit of time in the gym, but just has a problem with breast tissue causing an embarrassing appearance for him. And he always wears tight shirts. You can even see, I think he's kind of got a farmer's tan, if you will, because he just never takes his shirt off. And then afterward did much better. Had once again, a combination of liposuction and tissue excision, and that got him where he wanted to be. And the only scarring is really at the underside of the nipple areola complex. Another young man, once again, pretty avid exerciser, works out a good bit in the gym, and he's in his early 30s, and you can see quite an improvement on this lateral view. between the before and after photos. He has that breast form with an inframammary crease, and then it's no longer present after the surgery. This is a gentleman in his late 30s that I just recently operated on. He came up from Miami. He's a young physician in Miami. Not a terrible problem, but enough that it really bothered him, and he, once again, avoided social situations where he had to disrobe or, bathing suit type situation. So here he is, post-op on the right side. You can see on the oblique view at the top, you see on the left picture a rounded, kind of a pointed breast form, if you will, and then that's resolved in the post-op picture. Once again, very little scarring, just the nipple areola area. One other thing, too, a lot of men use, plastic surgeons use drains, closed suction drains. I try to avoid that. To me, putting in a drain is going to leave another scar. And granted, the drain scars aren't terrible, but they're still a scar. And people come in to me because they want to have a great-looking chest. They don't want to have any kind of visible scars, and putting a drain in is just going to leave a scar. And I've had good success with this combination of liposuction and tissue excision without having to drain the patient. I have a number of patients who come in during their early college years or late high school years. They have the surgery, and then I may not see them again for post-op pictures until much later. And this is one of the patients that's in my photo album that I show people in the office. He was around early college age when I did the surgery, and then it was about 4 years later when he came back and I got his post-op pictures. So believe it or not, it's the same patient, but he looks a little bit different because he's about 4 years older and he's physically matured. This is another young man who has had surgery just recently. You can see it's not a terrible problem, but enough to be problematic for him. You can see in the oblique picture on the bottom left that he's got that puffy nipple appearance, kind of a projected breast appearance, and then that's resolved post-op. And he was very happy with the result afterward and has done very well. Another gentleman, this gentleman's in his early 40s. He's from Cocoa Beach. He spends a lot of time fishing. He doesn't like the appearance of his chest, but it didn't keep him from going out on the fishing boat without a shirt on. So once again, you can see in that bottom left picture a really distinct inframammary crease, truly like a breast form. And then post-op, he looks much better. Now, I've got a video. I think, Matthew, this is our post-op patient. The patient before the last one actually came into the office about a week ago, and he's a gentleman that I operated on when I filmed the other young man. So he's done very well, and I just wanted to show you our interaction at his last visit. Okay, we're here with a patient, a post-op patient who had his gynecomastia surgery about 6 weeks ago, and he's doing fine. You can see he's got a nice flat chest. We recorded his surgery, and you can see quite a difference when you compare with the before photos. He looks a lot better. He's got nice pec muscle definition because he's in good shape and he works out a good bit. But he no longer has that breast form, that breast shape. Nipple areola complexes are flat. He doesn't have the puffy nipple problem that he talked about pre-op. Go ahead and flex your muscles for me. Flex really hard. You can see he's pretty flat. There's not a whole lot of subcutaneous fat here. Okay, you can relax. So overall, he has a much improved shape. You feel pretty comfortable with your shirt off going out to the pool and whatnot?
Yeah, day and night difference.
Yeah, good. Any problems after the surgery at all?
No, just a little bruising from the lipo probably.
Okay.
That was about it.
And you said there wasn't much pain for after a few days?
Yeah, after the first 3 days maybe. It's probably the worst.
Okay, all right. And we talked earlier about the gym. He's already ready to go back to the gym. He kind of misses his workouts. And I usually tell people no workout with weights, upper body weights, for about 6 weeks. But he can now go back without any restriction, do whatever he wants. Okay? Very good.